catalyze local action, and amplify the voices of people affected by cancer. From providing medicines for pediatric cancers to our global campaign to eliminate cervical cancer, we're working to improve the lives of millions. On our World Cancer Day, we honor the courage of those affected, celebrate scientific progress, and affirm our commitment to health for all.
All right, that was Mr. Andros Ghebreyesus, the WHO DG Director General there, talking and giving a speech as far as the World Cancer Day is concerned. It holds every 4th of February. 2 days ago, it held again. So for the whole week, we are going to be talking about it, especially the place of advocacy and awareness. And by the way, still from the WHO, Cancer Day 2025, the theme, I think it's a running theme for 2025 to 2027, United by Unique. United by Unique places people at the center of care and explores new ways of making a difference. Cancer continues to pose a global public health challenge, and multiple factors, aging populations, unhealthy behaviors, infections and environmental exposure, among others, are contributing to the growing burden of cancer. Individuals, families, and health systems are increasingly feeling the detrimental emotional and psychosocial impact and financial strain due to cancers. And most of the countries are challenged by uneven access to cancer prevention, diagnosis, treatment, and care tools and systems, invariably affecting more the poorer segments and population growth. Quickly, let me add that an estimated 20 million new cases and 9.7 million cancer-related deaths were reported globally in 2022, with nearly 70% deaths occurring in low and middle-income countries. The Southeast Asia region estimated to have 2.37 million cases and nearly 1.53 million deaths due to cancers during the same period. A lot to really talk about, but then we'll try and narrow it down. We are global citizens, we know, but we'll try and narrow it down to how it affects us here in Nigeria. Different forms of cancer, things that we need to know. And that's why we have with us today a very experienced medical doctor. He's a medical consultant, Dr. Adedapo Adetoye. He joins us virtually from Lagos. Thank you for joining us. Good morning, sir.
Thank you. Good morning, Nigerians. Good morning, Femi.
Thank you very much for joining us. Now, Mr. Ghebreyesus of the WHO has spoken, many persons have spoken on the matter, especially at the theme of this year's World Cancer Day, which says United by Unique. But we want to Nigerianize the conversation because we are first Nigerians before we talk about the global perspective to it. Doctor, tell us, what do we have today as far as cancer advocacy, awareness, funding, impact is concerned?
Okay, thank you once again. One would not want to say Happy Cancer Day. It occurred 2 days ago. Cancer is a very debilitating disease and will be terminal in nature if care is not taken early. The Nigerian picture will be like, as per advocacy, a lot of advocacy programs are ongoing. A lot of Nigerian doctors are trying their best in terms of research and even offering care to the patient. ETC and all over Nigeria now we have AGO, championing the cause led by Professor Alatishe. And this is an advocacy group and a treatment group as well, liaising with a body in the United States of America. A lot is being done. But despite all the subsidies, quote and unquote, and all the support, the cancer patient still has to bear some burden. In terms, at times they could go on and do screening, and then at the level of care, the body may not be able to carry the whole burden. The cancer patient still has to do a lot. The government is trying what the government could at the moment, but I think where the challenge is majorly in Nigeria is the fact that people don't report early. People don't report early. when you notice something different in your body, it need change, the right thing to do is to quickly report to the doctor in the hospital to check it. And if there's a need, some laboratory tests will be done, radiological investigations will be done. And if it is suspicious of cancer, quick action will be taken. That could prolong life. I'm sure some of the patients will be listening to me now, those who reported early and also subscribe to the treatment modality early. That is another problem in the environment. We seem to have problem with religious beliefs and so many other, idiosyncrasies, where people who have cancer, they've seen the doctor has diagnosed it, but some other people are deceiving them. You then hear things like cure your cancer without drug or surgery. And that fellow goes away for 3 months trying all those things. Some will lie to them that they can suppress those things by taking fruits. And you see them spending hundreds of thousands of naira on coconut water, all sorts of fruits, buying things, thinking they are antioxidants. But you are talking about cancer, no prevention now. And, before they come back, it has advanced so much and it becomes terminal. And such people will not survive it. We have a lot of cancer survivors because of the efforts being put in place by individuals and groups. And all I can say now is that we are advocating that the Nigerian people, the rich ones amongst us, should also find a way of investing in trying to alleviate these problems among our people. Those who are financing from outside Nigeria, they are not Nigerians, but they committed their resources to caring for others in other nations. So that will be a form of advocacy in addition to this.
All right. So
that's just a brief picture.
Yeah. Thank you, Doctor. So that we don't jump the gun or we don't assume that everybody has a knowledge of what we are talking about. Let's look at the cancer itself, the causative factor. What causes it? Because this morning, we know we have a very short time with it, but I want us to dispel as many myths, many misinformation as possible. Because many persons have different dimensions to that. Oh, it has a cause. When you do this, you have it. You are the doctor here. What causes it? What do we know about it? And, as I said earlier, we are putting it in the Nigerian context so that people will really understand what we are talking about.
Okay. When you talk about the cause of cancer, we may, let me put it this way. It's related to gene. That is the constituent that describes us, that makes us manifest the features we manifest physically. So we have what we call proto-oncogenes in the body. These are bibliograms. That is, certain genes code for cancer. And there are other genes too that code for, trying to fight against those proto-oncogenes being activated in the body, basically. So it is when the ones that we have the tendency of causing cancer, when they lose control, then the body system that is supposed to grow at a particular rate, the cell, will then lose control and grow at an exponential rate that is not under control. And that becomes a mass. That's a swelling that we see. But the thing is that there are some other associated factors that could trigger that gene. So if one is not exposed to them, like irradiation, some healthy or some unhealthy lifestyle, like alcohol, smoking, all those things, depending on the nature of the cancer. Let me give you an example. In Hiroshima and Nagasaki during the Second World War, an atomic bomb was thrown, and thereafter, after the World War, they found out that there was a lot of blood cancer in that environment. So that made them to associate it with the radiation from that, the explosion that occurred there. So we have associated factors, but the basic thing is that most of us, if not all of us, have the gene that codes for cancer, but if the environment is not favorable, the gene does not come up. It is not activated. And there are some other genes in our body that also help, that protects us against cancer. Let's leave it at that.
Yeah.
So it all depends on the type of cancer we are talking about.
Okay, doctor, does it seem like we're having an increase in cancer patients now? Somehow, some persons are relating it to the kind of things that people eat. Is it also an underlying factor?
Yes, it could be. But why we are having an increase is awareness. And, our ability to diagnose this cancer is increasing day by day because people are acquiring more equipment. There's awareness. In those days, when I was much younger, as a small boy, most cancers were termed Ota in Yoruba land. They will say somebody used juju on the fellow and that area was just swelling. Now we know better. When somebody has swelling in the breast, we can do justice to that. Yeah, I can't go into details now. Some who have leukemia, blood cancer, they will now be diagnosed because there are diagnostic, let me say, equipments around now. So that is increasing the awareness. When somebody goes to the hospital and is diagnosed, and then we then treat that fellow, the fellow will tell another person, no, this thing may be what happened to me the other time, and this was what I did. So the awareness is increasing. So documentation is also increasing. This is the age of data. And, information travels faster now than before. Things could be happening on the street and the next thing will not hear some years back. But now, information is traveling faster. This is part of what we are doing now. So it's because of the awareness.
Okay, because of the awareness and then for information too. How many stages are there to this cancer?
I didn't get that correctly.
I said, how many stages are there to cancer?
Oh, no, when you talk about stages, staging is to help the doctor to treat. Okay. It's not for everybody. We just grade them. You understand? Okay. The most important thing, when we classify cancer, we classify them according to their point of origin. Maybe it's breast cancer, prostate cancer, pancreatic cancer, cancer in the eye, brain cancer, and the likes. That is enough for the populace to know. But, the way we grade them to know whether this is mild, that is, this is just starting, it has not crossed boundaries, or when it is now invading some other structures, or it has spread to some other part. The primary thing is in the breast, for example, but now we are finding similar things on the liver. Or it's now from the prostate, but we are now finding it in bone. That is metastasis. So those gradings are for the experts who want to manage them, to know what approach, universal approach, whether in Nigeria or in US, when we grade them, we then know that.
Okay. Hello? Are you still with us, sir?
Okay.
We'll try.
Yeah.
And reconnect, because it's very important. It's an ongoing. The whole week will not even be enough because of. And I would love to, possibly when he comes back, we'd like to ask him the prevalence, especially in Nigeria. What type of these deadly disease? Because he has said it could be fatal if actually. Can you hear us, sir?
Yes, I can hear you.
All right, quickly, sir. Let's talk about the prevalence in Nigeria. Before, people know about breast cancer, cancer of the cervical, and all of those things. But is it true? Let me even ask two questions.
In good time, so that the life of that person.
Is it true, sir, that it can attack any part of the body?
Yes, it can. Any part, including skin. In fact, in men, the two rapidly killing, the rapidly fatal cancer are skin cancer and prostate cancer.
When it is mild.
Okay. Yes?
When you were speaking earlier, you said they are categorized because when it is mild, it's is it better controlled, and what is the guarantee, or what is the percentage of the person's survival?
Yes, if it is reported early, in fact, there are some that are curable if caught in the early phase. For example, cervical cancer, you understand? There's even pre-cancer phase. If the woman reports early, there are steps that will be taken. And then that's why we keep asking people to go for screening, like the pap smear. Even breast cancer can also be prevented by going for mammography, ultrasound scanning. We teach women how to palpate their breast and check if there is any mass in there. And if they feel any, they should report early. So many people have gone through all this. So screening is the basic thing. And if one notices anything, because by the time you are seeing the cancer as small as the tip of the finger, that cancer has gone far. So the screening is the major thing.
All right. Some experts have talked about very seriously about funding. That funding. And Nigerians would like to say, okay, if we have enough money, which most likely we might never have as a country, because human needs just like any nation, is insatiable. Let's just assume that there is funding. What part, how do we channel it? Is it in awareness? Is it in treatment? Is it, what part? Do we really need this money? Because many persons will say, is funding really the problem?
Yeah, we need it for several aspects of it. For screening, for advocacy, for screening, for treatment, even for research. Because we are peculiar. Most of the research we are relying on for treatment came from some other parts of the world. But a lot of research is going on in our own environment now to really, determine what are the features in our own environment. Because, in some areas we are different from the whites. We are different from the Caucasians and, the Asians. So we need to know our own peculiarities that could, affect how these things manifest in our own environment. So we need money for research, for advocacy, like we are doing now. Thank you, this television station, for doing this. It's a form of awareness. So we need money to buy machines for screening, to support the laboratories for quick diagnosis, to train more people to be interested in this, so that they will have the skills to be able to assist those who have this. And our people also need to invest, in not engaging in dangerous, some associated behaviors that could make people to be prone to cancer, like we said earlier on.
So you said the analysis we're working with are basically from other parts or other regions of the world. That's not
what I said, absolutely. Okay. I'm saying that, these researches came from some other parts, including the drug we are using for now.
Okay. So
there are a lot of research work going on here to elaborate our own peculiarities and see. And some of those researches are already yielding results, showing the world that we are different. That even the pattern of the cancer here is also different from what they are seeing over there. So, and that is influencing the research in terms of the drug that will be used and the therapies as well.
Okay. So are we still getting intervention or monetary intervention from outside the country?
Sure, in several forms.
Okay.
Even if I'm sure where you are going is the fact that what the U.S. government is saying, but where people are offering to train you, whether by visiting Nigeria to come and train people, they are still allowing us to subscribe to Zoom meetings where things are discussed and things like that. You can even send some people out there to go and learn some skills in the management of these cases. I think a lot is still going on. We are collaborating with the world. That's the medical field for you. It's a universal language that we speak. And people are interested in other people's development, because if the burden is increasing in Nigeria and nothing is done about it, it's a problem for the WHO.
All right. There is a lot to talk about, but time is really of essence this morning. We must sincerely thank you, Dr. Adedapo Adetoye, for your time and your take, and the enlightenment, the education and information you have just provided this morning. Thank you, sir. All right. It's an ongoing conversation. We will continue to talk on these, because you can never exhaust the topic and the questions around health, but in this case, cancer, because of its terminal nature that he talked about. If caught early, there could be a remedy. He even said it could be cured totally if caught early. But then what are the hopes? Because many persons have left the prevention zone, they have left the mild zone, and possibly they have an established case of cancer. What do they do? How do they go about it? The message of hope, trust us on this program and in this station to do justice to that. We'll take a quick break right now. When we come back, we'll be switching gears to talk about something different, but very interesting. Stay with us.